right, so maybe we'll just get started. So welcome everyone, week 2 of our 5-week tutorial series. So hope you all had fun last time. It was a good session. So today we are going to go over healthcare and professionalism and ethics. So we are going to go through healthcare and professionalism and ethics. As we did last time, first 30 minutes is the quiz. I know last week some of you experienced problems getting to the PDF, getting to the Google Form. So what we did is Bruce has just emailed out the link to the quiz. We are also going to put it in the chat video over here, chat box over here, and we are also going to show it up on the screen. But we'll just do the quiz for the first 30 minutes, and then at 12:35 we will get back together, and we have Pradeep here, and we'll have Jason joining us, and we'll go through all the questions. So it's almost 12:05, it's 30 questions, so we are giving 30 minutes for that. A little less than what you'll get in the real exam, but let's try this way. So okay, so with that, let's maybe get started. Bruce, can you also paste the link in the chat box? Okay, there you go. So you have the link in the chat box, and for those of you who can't access Google, you have it also in your email. So if anyone still has trouble, just put a message in the chat box and we'll get back to you personally on that. All right, good luck. We'll start back again at 12:35. Okay, it's 12:35 now, so let's go ahead and get those quizzes submitted. If you haven't done that, let's go ahead and do that. If you missed out on a few questions or something is remaining, you can always go back and retake the quiz later if you want to. But looks like we have about 40 of us on the call today, so would encourage everyone to turn on your cameras for this part of the session. Make this session pretty interactive. We want to answer your questions. We have our two speakers for these sessions today. We have Pradeep Podila. I'll ask him to introduce himself in a minute, but he's here. He will go over the healthcare section, and then later on we'll have Jason Leandrini who will be joining us and going over the ethics and professionalism section. So without taking more time, I'm going to hand this over to Pradeep. As usual, if you have any questions for him, just feel free to unmute yourself or put it in the chat box, and then we can take it from there. All right, so over to you, Pradeep. Why don't you introduce yourself just a little bit, and then go ahead and take over the slides sharing from that point.
Thank you, Rahul. Can you hear me?
Yes, we can.
Great, excellent. So happy Friday, everyone. Thank you for being here, and really excited that I had an opportunity to be a part of this great effort from GAHE. So I am Pradeep Podila. I am a population health and health services researcher with over 15 years of experience working in varied sectors like academia, not-for-profit, as well as currently working with the federal government. And I've also worked as an adjunct faculty in the health administration program back in Memphis, Tennessee, and had the opportunity to also serve as an item writer for the Board of Governors exam for American College of Healthcare Executives. And it's a pleasure to be, here today. So thank you so much. And I have also added my email address within the chat. So after today's session, if you have any questions, please feel free to drop me an email. And let's go ahead and get started. I hope you had a great experience taking those questions, so don't worry about it. This is part of the learning experience. So let's go ahead and start with the first question. So which of the following environmental assumptions for the next decade is not reasonable? So Rahul, is there any way you can see how they have responded? Any breakdown of how they have responded?
I will try that, but you keep going. So
okay, sure, excellent. Yes. Okay. So always be careful whenever there is a question that has that negation term, which is not. When a term is not is added within a question, always be careful. And you can take two approaches: select the best answer, or you can take the option of elimination. So let's go over it. And would someone like to try what they have answered for this question? Just a couple of answers to gauge the responses.
B.
B.
Did you say B?
B, yes.
Yes, that's correct. Yes, thank you. Thank you for being brave and turning on your voice and speaking out. So thank you. Yes, that's correct. Because if you take a look at this, the negative term is the key over here. So for this, I would take an approach of a process of elimination. So cost containment pressures will obviously continue to be a dominant factor in the delivery of healthcare services. So that is not the right answer. So option C is continued growth in new technologies will focus on cost-saving technologies that move care from inpatient settings to out-of-hospital settings. Yeah, that's exactly the case. We are trying to utilize more telemedicine, and the part of telemedicine has increased more during the pandemic. So that is not the right answer. And the D is there will be continuing efforts to measure and assure quality of healthcare services, because quality will always be the primal focus, as patient is at the center of all the services that we provide at healthcare. So due to that, answer B is the best option, because answer B is about there will be a decreased morbidity, because morbidity will continue to increase because of the lifestyle and other factors, the influence of other factors. So just because the increase of marketing efforts and technological advancements have been happening, that will not impact or reduce the morbidity. So B is the best answer. So now let's go to, yes, I do see a hand raise. Nita, go ahead.
Yeah, I just want to ask, I changed my answer to the wrong answer. I had B in the beginning, but if you go back to the question, I know you said the word not, but what threw me off was the word assumption. So how do you get past the word assumption? Because that's what threw me off and made me change to the wrong answer.
Exactly, because we are talking about these are the external factors that are outside of the healthcare. So that's the reason we are talking about the assumptions, because this is in the healthcare ecosystem, we are looking at the healthcare entity itself and all the factors that are around the entity. The around entity will be the insurance, technology, and in addition to that, also looking at the market factors as well. So that's the reason we are using the word assumptions, because we are talking about the environment surrounding the healthcare ecosystem. Thank you. Yeah, feel free to raise your hand and make it as interactive as possible. So great. So now let's go to the second one. The principal reason for small and mid-sized employers to join buyers cooperatives is to enable which of the following? So can I see some brave people?
Most of them answered B. So
okay, excellent.
96%.
Perfect. Thank you, Rahul. And that's great. That's fantastic. You guys are doing great. So let me just give some context to this. So the buyer cooperatives, the concept of buyer cooperatives dates back to 1844 in the United Kingdom. So the idea of buyer cooperative is to have that risk pooling and risk sharing. So that is the primary focal point behind what is the main reason why small and mid-sized employees join the big cooperatives. It is about risk pooling. That is the underlying theme behind it. So there may be a question on the exam which talks about the concept related to this, and that is cost sharing, risk pooling. Just keep that in mind. Those are the two key terms that you need to keep in mind whenever we are talking about bringing together small and mid-sized employers to join a big cooperative. So answer B is the best option. So let's go to the next one. So the development of preferred provider organizations, also referred to as PPOs, was originally intended to do what? Is it to guarantee that hospitals maintain their occupancies? Or option B, promote networks that would evolve into multi-hospital systems, offer an alternative to the HMO, health maintenance organizations, and finally force high-priced hospitals out of local markets via discounts. What is the best option for this particular question? Any hand raises or any options?
Option C.
C, someone said C, okay. Any other options? Anyone has submitted any other options?
Yes, some submitted A and B as well. So.
Okay, A and B, okay. Thank you, Rahul. Okay, great. Yeah, let's go to the basics here. We're talking about HMOs and PPOs, right? So HMO is the health maintenance organization. So in HMOs, we would need a primary care physician to make that referral to a specialist. And in a HMO, when someone goes outside of the network, those charges will not be covered unless there are some special cases of emergencies. And HMOs have the lower monthly premiums. Now, when we look at PPOs, the word itself says preferred provider organizations. The key word here is preferred. Always try to identify those keywords in your questions when you are looking at it, as well as in the options when you're trying to select the best answer. Because there may be multiple good answers, but you need to select the best answer. So preferred, the reason they are calling it as preferred is they would like the people who are signing up this go to those preferred entities for services and stay within the network. But in PPOs, you can also go outside of the network. So that means they are less restrictive than compared to health maintenance organizations, HMOs. But the premiums will be high. So that is the reason why PPOs have evolved as an alternative to the health maintenance organizations. So I hope that satisfactorily answers the options. And at the same time, as someone who was associated with the Board of Governors exams training in the past and the current one, a tip I would like to share is when it comes to this particular topic, knowledge area of healthcare, this is an overarching topic, which is a very broad topic that touches upon many different knowledge areas. So try to have that grounded basic knowledge about HMOs, PPOs, exclusive preferred organizations, which are EPOs, and points of service, which is POS. So after today's session, I will share a 2-slide summary with you, which might be helpful for your preparation for the exam. So have a basic understanding of the differences between these, and there may be a couple of questions on the exam. So just keep that in mind. Great. I'm sorry, for a minute I was thinking I was watching the screen, but I was the one who is navigating it. So thank you, Rob. Okay, so the next question is, okay, an important reason for a hospital and its medical staff to explore the development of physician hospital organizations is to. What is the best answer for this question?
So a lot of them answered. The response was split between A and B over here, almost equally.
It was between A and? Yeah.
A and B.
Okay, A and B, okay. Great. So the best answer here is the important reason why hospitals and medical staff try to explore this physician hospital organization is to ensure and to permit contracting with the plans that want to buy both hospital and physician services. So that is the key over here, trying to get the biggest bang for the buck. So how do we do that? We try to see that collaboration and also trying to get the maximum services out of both hospital and the physician services. That's the reason why we are talking about this collaboration again. Whereas the other answers are good. Begin development of a hospital-based health maintenance organization may be a good option, but the best one is to make sure you are drawing upon the services from both the hospital and the physician services side. Great. The next one is healthcare organizations encourage their employees to contribute to United Way and other community groups, primarily because option A, promote the image of the healthcare organization. Option B, provide funds to support many community services. And option C, will return funds to the healthcare organization, as well as D is to have healthcare organization executives on the boards. So on the side, I just wanted to, yeah, go ahead.
Most of them answered B for this, which was the right.
Oh, wow. Excellent. That's absolutely correct, because United Way has exclusively participation in the community-based services, and this also indirectly promotes the image of the healthcare organization. That's the reason when I said there may be some good answers, but try to select the best answer. That's the key over here, because on the actual BOG exam, you will always have multiple choice questions, and the one answer or the best option is the best answer. You will not be asked to select more than one answer. Because United Way agencies are the major financier of voluntary health and social service programs at the local level. So support for them is essential, and most organizations, health and otherwise, encourage employees to support them. And this also boosts the image of those organizations. So the next one, which of the following are not examples of impairment of health professionals? Option A, substance abuse. Option B, cognitive ability changes. Option C is sensory perception deprivation, and surly personality.
Most answered D. Most answered D.
D, yes. Yes, absolutely. Because if we look at the first three, substance abuse, cognitive ability, and sensory perception, they are somewhere related to a diagnosis or a medical condition, whereas surly personality is an individual's behavior, like unruly behavior of an individual.
And yeah, while it may not be the best kind of person to work with, that doesn't mean the person is not a qualified professional. So that's just the way it is.
Great. So the next one is, what age group will consume the greatest per capita healthcare resources in the 21st century? Which of these age groups will consume greatest per capita healthcare resources?
So the answer here was split between A and B. So yeah.
Oh, that is fantastic. Yeah. Thank you, Rahul. And this is really great, because I was expecting something like that, Rahul. And let me share my rationale. Because there was a study that was conducted by NIH, and this study was on health statistics and healthcare services utilization. And what the study has found out is the oldest of the older age groups, that's the keyword here, the oldest of the older age groups will account to about 4 to 9 million additional healthcare services between 2005 to 2030. So always remember, on the exam, whenever such a question comes, always select the oldest of the older groups, and you will never go wrong with that. So that's the reason answer B is the best option, even though A is a good option. So because answer A says 65 to 74 and stops over there, but answer B says 75 and above. If it is 65 and above, I would have gone with A, but it is 75 and older. So that's the reason B is the best option. On the actual exam, you may see 75 to 84, and then another option may be 85 and above. Then you have to select the oldest of the older options. So go with the second one.
So two things here, and I know it's like, sorry, someone's mic is on. All right, so two things here. So this was a tricky question, and I purposefully, in doing the options, I tricked everyone by putting that first one up there. So two things to remember. One is, the moment you see 65, all of us are tempted to attempt on the very first option. So just make sure you read all the options for any question before you pick one. Secondly, the keyword here is per capita. So obviously, while there are probably a lot more people between 65 and 74, and as a group, they consume a lot more resources. But per capita, the oldest people, as Pradeep said, will consume the most resources per capita. So just reading all the words is important. Otherwise, it's an easy question, except if you don't read the question, sometimes you get it wrong. So
absolutely, very well said. I could not have said it in a better way, Rahul. This is a tricky question. Yeah. Definitely a tricky question, because obviously, I mean, as we are working in healthcare, we think about mortality rates, readmission measures, talking about Medicare population 65 and above. Obviously, we will automatically go with the 65 as the option. So that can be a tricky part over there. So absolutely.
Adiri, you have a question?
Yeah, I mean, I was basically, the reason why I picked the choice was the same thing that you just explained, based on number of population, like 75, 74 people who are 75 and above are less than people who are 62 or something. So I was looking at it from that population aspect that you just explained. So
Sorry, the voice wasn't clear to me.
Yeah, I think we answered his question. Per capita was the key.
Okay, sure, great. Thank you. Great. So the next one is the principal advantage for an inpatient facility to affiliate with the geriatric care program is that such an arrangement, what is the best option here? Provides a continuum of care.
Most of them got A.
Okay, perfect, perfect. Because, yeah, thank you, Rahul. So when we talk about geriatric care programs, there are 5 domains that fall into this, and I will also share that. And apologies, I'm not a clinician, so I do not remember all 5 of them, but some of them is like instability, immobility, intellectual impairment, and there are 2 others. It is heterogenesis and something else. So maybe some clinicians on the call may be able to help us, but this is when an inpatient facility tries to affiliate with geriatric program, we are talking more about those individuals that need additional care, like the elderly patient population. So here we are talking about providing the continuum of care. That's the key word over here. So the next one is a hospice may be described as 1, intermediate care facility, extended care facility that specializes in treatment of chronically ill, facility where terminally ill patients can receive special attention, and the final one is interrelated group of healthcare services. What is the best option that describes hospice?
Most of them put C.
Perfect, yes. Yeah, because hospice is about taking care of the terminally ill patients. And also there may be a tricky part, a question on the exam which talks about hospice and palliative care. What is the difference between hospice and palliative care? Palliative care is more about making sure the quality of life is maintained. We're not actually treating the patient, but hospice is more about working with the terminally ill patients and giving special attention to those individuals. So that may be a tricky part on the exam. So pay attention to hospice and palliative care as you think about it. And also extended care facility is more like an extension of the inpatient services where before the patient is discharged and after the inpatient services, some kind of rehab services may be offered to the individuals. So also know the difference of that extended care facility as well.
I think the one of the things is just knowing all types of organizations and what they do. Just having that general knowledge is probably what this question is about.
Absolutely. Thank you, Rahul. Great. So the next one is the primary function of an extended care unit is to provide which of the following: post-acute care services in a rehab-oriented environment, self-care facilities for ambulatory patients, additional facilities for geriatric cases, and more intensive nursing care for chronically ill patients.
The responses here was split between A and D, first and the last one. So maybe explaining what goes.
No, absolutely. Yes.
Yeah.
So as I was talking for the earlier question, the extended care unit is more about offering those additional services before the individual is discharged home. So this is more about an extension to the inpatient services that are offered in the inpatient settings in a more rehab environment where the individual is offered additional services to recoup so that the individual can be discharged. Whereas when we're talking about the more intensive care for chronically ill patients, we are talking about maybe those post-acute care kind of settings.
And one of the reasons why that may be a bit confusing is there's a decent amount of overlap where nursing homes do post-acute care, as well as some facilities which are like long-term acute care, LTACs. They kind of take care of chronically ill patients, but thing to remember is extended care unit. Literally, the origin of that was purely as an extension of acute care. So that's purely post-acute care. They don't typically house patients for like 2 years or whatever. So the last one is more nursing homes. The first one is post-acute care or extended care or LTACs. That's the definition.
Fantastic. Thank you, Rahul. So the next one is the sole purpose of the medical or professional staff organization is to, which of the following: meet accreditation standards, review the standards of patient care, review the credentials of physicians applying for membership, and safeguard patient safety. So what is the sole purpose of medical and professional staff?
I put B because, not because I knew the answer, but because I felt A, B, and C all led to D. They're all, all of those are encompassing in D. So you meet accreditation standards for patient safety. You review standards of care for patient safety. So D seemed like the most complete answer.
No, that's very well said. The primal focus is on patient safety. That's the most important thing as per the Institute of Medicine standards. Safeguard the patient safety. But all other things are very important in the journey towards that patient safety. Very well said, Lorraine. I hope I spelled your name correctly. Yeah, thank you.
Yes.
Thank you. Very well said. So that's the reason we have to select the best among the options that are given. There may be many good answers, but select the best option. And you will not go wrong when you think about patient being the center of the primal focus when it comes to the healthcare ecosystem and things related to the patient aspect of it.
So one of the things I'll share, these are like the hints for the actual exam. There are certain options when you see them, really think if they are the correct option. So one of them is this patient safety. So whenever you see an option for patient safety, there's a strong probability it's the right answer. On the very next question, it's not the right answer, but in most cases, it's the right answer. Another of those options is governing board or governing body. Whenever you see governing board, governing body, it's probably, or whatever, board of governors, whatever you see that's probably the right answer. So just,
I got the second one wrong. I got the next one wrong.
That's why I put
I
the next
didn't
one.
use the same thought process.
Exactly. It's red. So let's move to the next one. It's about that.
Yeah, absolutely. The next one is the establishment of an appropriate credentialing procedure for members of the medical or professional staff should ultimately be a decision of entire medical professional staff, credentials committee, governing authority, and medical professional executive committee.
Yeah, so whenever you see the word ultimate and authority and a healthcare organization, governing authority or governing body, that's the answer. That they are ultimately responsible for everything that happens in our organization, from like mowing the lawn to doing cardiac surgery. Everything is ultimately responsibility of the governing body. So they have fiduciary responsibility, they have everything, including
Very well said.
Clinical care, because you'll see those questions. These are all trick questions. Who is ultimately responsible for quality of clinical care in our organization? Governing body, not physicians, not clinicians, it's governing body. Ultimately, governing body. That's it. No,
absolutely. Try to look for those keywords ultimately, and also there you may see different variants of this: governing authority, governing board, or board, but that is the best option and you will not go wrong, as Rahul said.
I have a cool question for that.
Sure.
So in like when you look at the procedures and plans and the difference between them, see the management doing more of the procedures writing for, to do, certain things, but the plan, the strategic aspect of it is for the governing body. So I think that's another tricky question. When I saw the procedure here, I was like, well, it's more like, the management rather than the government body. So I think it was definitely a tricky question when I saw the word procedure here.
Yep, and that's why that key word over there is ultimately. So just remember that that's exactly why this question was put in and why it's one of those tricky ones. All those things makes us think it's some other entity. The moment you see the word ultimately, it's governing body. So that's the one to look out for, the word.
Sounds good. Thank you.
Great. Thank you, Rahul. So the next one is, insurance companies and other payers have introduced pre-admission certification for elective hospital stays in order to do which of the following: cause physicians to reconsider need for service, facilitate communication between hospitals and the attending physicians, establish clinical necessity prior to service, and encourage the patient to obtain a second opinion.
Most of the answers C.
Great, fantastic. Yeah, it is about establishing the clinical necessity prior to the service. Yeah, go ahead. So the next one is, in the field of healthcare services, which of the following trends has significantly increased the need to develop more comprehensive and more systematic credentialing process in healthcare facilities? Number one, the increased number of independent healthcare practitioners, the expansion of governmental regulations covering the operations of healthcare facilities, the growth of ambulatory health centers, and the growth of liability of healthcare facilities for malpractice by healthcare practitioners.
The answers here were split across the four. So could you go through this one a little bit? So it looks like we had equal number of answers for each of them.
Absolutely, absolutely. So here, I mean, this is touching upon many different things. It's talking about independent practitioners, increase among independent practitioners, then talking about the governmental regulations that are enforcing the changes within the operations of healthcare facilities, and also a growth in ambulatory healthcare centers, which is like more so going towards outpatient settings with the accountable care organization, and also emphasis on population and patient and public health. And the last one is the growth of liability of healthcare facilities for malpractice by healthcare practitioners. So the best answer over here is, because we are talking here about an increased need to develop more comprehensive and more systematic credentialing process. Since we are talking about credentialing process over here, like a systematic credential process, that is the key word. The best answer is the growth of liability of healthcare facilities for malpractice by healthcare practitioners. And there is a study that was conducted by the Medicare and Medicaid Research Review. And according to that, the premiums of healthcare practitioners are increasing about 30% each year. So that is one of the reasons why option D is the best option over here. Now let's go to the last option, last question, which is, it is important for the CEO of a healthcare organization to represent the organization at state and regional associations and to other organizations in the community because A, the organization spokesperson is the person who is the most knowledgeable about the organization. The CEO can use the opportunity to explore external threats to the organization. These activities develop exchange relationships and are therefore crucial to the organizations. And option D, consumer surveys indicate that within the community, CEO is the most visible spokesperson of the organization. So what is the best answer for this particular question?
Most of them gave the answer C, but a few of them did answer A, B, or D. So most of them got it.
Answer A and C. Yeah, great. Thank you, Rahul. So yeah, definitely the organization spokesperson, CEO is the primal head, of course. Governing body is the ultimate authority, but as CEO, I mean, the CEO looks like the actual spokesperson for the organization, who is and also who should have the most knowledge about the organization, like the institutional knowledge. But the key here is, as the CEO, and also as we are moving from the inpatient setting into the population health, it's always about collaboration. That collaboration with other entities is what really helps a particular organization. For example, if you think about frequent flyers or super utilizers, these are the patients who actually bounce between different hospitals. If you want to get into some kind of an understanding to understand what is a good way to estimate the real burden of a disease condition in the community, in some instances, the organizations have to come together, form a partnership, and build a research collaborative. So how can such things happen? Such things happen when the CEO is representing the organization at regional and state associations and building that clout among the community. So option C is the best option if you look at the big picture. Of course, A is a good option, but C is the best option over here. And that is the end of the healthcare section, Rahul. So if you would like to add any final comments.
No, I think we covered that. Any questions that anyone from the audience has for Pradeep here or about healthcare? And of course, afterwards, you can email us and we can get those questions over to Pradeep if you need to. So, but any burning questions for him right now? Okay. Hearing none, then thank you, Pradeep. Thanks for going over all those questions. We'll be sending over all your slides over to the group with those answers. And if there are any questions, we'll let you know. We now have Jason Leandrini.
Thank you.
Yeah, thanks, Pradeep. We now have Jason Leandrini who has joined us. He will be going over professionalism and ethics. Hopefully all of you saw the video. Sorry, we sent it out last minute yesterday. So if you haven't watched the whole video, go ahead and watch that over the weekend or something. A lot of good information in there. And Jason, would you like to share your screen and do the slides from there? Is that easier for you? And I'm looking at the responses and I can tell you how, like, what's the proportion who got it right as you go through each of the questions. Yeah. So you're already a co-host, so you can probably share your screen. And Jason, I'll let you introduce yourself and take it from there. Okay.
Give me 1 second. Sorry, I always struggle with this PowerPoint thing because it doesn't work well on my computer. Rahul, it may be. Hold on a second. I know what the problem is. 30 seconds, guys. I'm sorry. All right, it's not working, Rahul. I'm not sure exactly why it won't let me.
Would you like me to share?
Yeah, yes, that would probably be best, so we can move forward. Okay, very nice to meet everybody. So I'm going to say a couple quick, and Rahul, I don't know if we're supposed to say this, but I'm going to say it anyways, and then you can tell me afterwards that I wasn't supposed to say it. Full disclosure, I have written test questions in the past, and so I know a little bit about how to answer test questions irrespective of the test. So I think, Rahul, you've probably shared this with them, but and Pradeep, I heard Pradeep talking about it as well, that most of the test questions, and I do not write for ACHE, so the Board of Governors, I do not do that, but most test questions can be limited down to 2, and you have a 50-50 shot. I will tell you, 50-50 for me is very good. I'm not a finance person. My background's in philosophy. So if I can do 50-50 on finance, I can guess the answers. And I am a fellow. I passed the exam and I know about this much about finance, all right? Just so you know my background, I'm the Assistant Vice President for Ethics, Advanced Care Planning, Spiritual Health and Interpretation Services for Wellstar Health System, and worked in Atlanta for a very long time. I've been a fellow for about 3 years, and I took this course and then went and took the exam. So it helped. I will tell you that it helped. So it's worth the time. It definitely is worth the time. All right. Any questions about generic questions before I get into it? All right, let's get into it then. All right, listen, this section shouldn't be super intense for you, right? I would say that there's not formulas and stuff you have to memorize. There's none of that stuff. It's sort of looking at the questions and I think I heard Pradeep say this again, like looking at the wording of the questions, irrespective of what the content of the question actually is. So this first one, so when considering ethical principles useful to healthcare executives, which of the following is incorrect? Okay.
Most of them answered B.
D. D, right. And D makes sense if you just look at the wording. You don't even have to know what non-maleficence, respect for persons, beneficence, and justice mean. I can tell you what they mean. Non-maleficence means don't do any harm. Respect for persons means thinking about the person's rule of their body. Beneficence means to act in the best interest of someone. And justice means to give each person their due and to treat people fairly, right? So looking at them, right, even if you didn't know those definitions, thinking about what you know, maintaining different levels of care and services based on social status and ability to pay appears to be wrong. Like just the wording of it appears to be wrong. The rest of them could be, you don't know, but you can tell that D clearly appears to be wrong. And so Rahul, if you'll go forward, 1 and 3 are correct, right? Care is supposed to be provided irrespective of the ability to pay. And we're not saying what happens in healthcare. That's not what we're the testing here. Like, do people who have ability to pay get different care? Yes, that's factually true. That's not what the test is testing. Okay. All right. Questions about that? Next question. So the major purpose of a code of ethics for healthcare executive, for the Healthcare Executive Association, right? So thinking about what we talked about for our previous one, Rahul, I'd be curious what they said. There we go. So B, setting forth standards of ethical behavior for healthcare executives. So you can see codes of ethics are not about enhancing the image. It may enhance the image, right? And codes of ethics may, right, set guidance for the advancements of members of the organization. It may do those things, right? But it doesn't provide a forum for discussion. It influences discussion about policy. So when you look at them, what is the one that has to be the case? It has to be set forth standards of ethical behavior for healthcare executives. The other way you could look at this question is think about any code of ethics. What's the whole point of a code of ethics, right? The whole point of a code of ethics is to set forth standards by which to measure the profession. Okay. All right. Rahul, we sort of answered the question. If you'll go, the next slide is the answer, and you'll see these are the sort of selections. Okay. Which are commonly recognized to be rights of each patient. So receive considerate and respectful care, communicate with the caregiver in their language, and be informed about their decisions. So the answer is D, all of the above. And the reason is if you think about any healthcare organization that you work in, they all have patients' rights documents, right? So think about what would be in that patient's rights document. That's how I would think about this question. So would it say you have to receive considerate and respectful care? Yes, it would have to. It wouldn't say the opposite, receive inconsiderate and disrespectful care. That you can't communicate with a caregiver in the language of your choosing. In fact, there are federal laws that say that. Be informed about and participate in decisions regarding your care. Yes, so it has to be D. Okay? And stop me along the way, group, if you're asking any questions. Rahul, yeah.
I'll add another thing to this. So one of those hints for the exam, again, just like governing body or patient safety are those two options. Look out for this option, which is all of the above or none of the above. Whenever you see those options, be really careful to read all the options over there, because it's probably, if there is an all of the above, probably all of them are correct. Again, this is not a rule, and I've seen questions where all of the above is just trying to trick you, but if it's there, then just try and read the options once more before you pick whichever you want. So just one of those things.
Yeah. Good point. So you nicely, Rahul, led into the next question, which asks, with respect to the process by which healthcare organizations maintain the confidentiality, security, and integrity of the medical record, all of the following statements are true except, right? Except, which one except, right? And that's probably what tricked everyone. You put D because you're like, well, yeah, they have to have policies, but the question isn't asking which ones do they have to have, it's saying except which one is it not, okay? Just so everybody knows, from a test writer perspective, these are not good test questions. Like they're just not. Like having questions like this on the Board of Governors exam, if they ask for my opinion, which they never will, if they ask for my opinion, I would say, do not put these kinds of questions on the exam, because really, to Rahul's point, you don't need to know the content of the question to actually answer the question. It's about the words used. So it's true except. And so the reason it's B, except, because they must have a mechanism to preserve the confidentiality identified as sensitive. So with respect to healthcare organizations, all of the following statements are true except B, right? Does everyone understand why it's B?
So I didn't realize you had to have a subpoena to move the medical records off the site. Like I thought that physically was the wrong answer, because I thought they were allowed to have like secondary housing as long as they owned the property. That's why I missed it.
I think it's I think what that answer is saying is you have to have policies, and Rahul, you can correct me if I'm wrong. You have to have policies about when records can be removed, inclusive of, and according to, right, court order, subpoenas, and statutes, whatever those, if there's a subpoena, then yes, you have to have a policy what you're going to do with that. It doesn't say that it's only by subpoena.
Okay, I misread.
So actually, this is a pretty tricky question. So if you read all of these answers, all of them look true. They are all true. The thing over here is, in option B, they are saying these last three words, which says identified as sensitive.
All right.
If you really think of that option, it kind of suggests if some information is not considered sensitive, then you don't need to have a policy about that. That's not true. For healthcare organizations, everything is sensitive. You have to have a policy for all your data, all confidential data everywhere. Now, there are policies in place regarding when you can release certain data, and that's when, is it really sensitive? Is it not sensitive? Is it a psychological or psychiatric kind of record, mental health record? Is it a pediatric record? Those kinds of things come into play. But you have to have mechanism to preserve confidentiality of all information. If this was all information, this would have been true. But if it's saying identified as sensitive, it's like, okay, if it's not sensitive, you think, oh, this is not, okay, this Susie Q who came over here, her record is not sensitive. Let's not have all that together. So that's not true. Everything is sensitive in the healthcare article. So this is one of those really tricky ones. And as Jason said, hope it doesn't show up, but just it can be there. So it's about everything in a healthcare organization is sensitive, and you have to have a policy for everything. So probably a kind of overlap between IT and ethics here, but
yeah.
I was reviewing AHEMA, some AHEMA questions a couple of days ago, and one of the things that I gathered from that is that the originating organization is the owner of the record. So that's why I chose A. You can send a copy, but the original record belongs to the original organization. That was my understanding.
In today's world, sorry, I'm getting an echo. In today's world of electronic health record, really, the original is kind of not very relevant anymore because it's a digital copy of everything. So it's probably the old. So again, some of these questions are built in the whatever 1890s, I always think, because what they are imagining is if a patient is moving from one organization to another, they used to actually give a copy of a file or the whole file. Or if a patient said, and again, this is for HMOs, if they would move from one HMO to another HMO and they are just transferred completely, then they would just hand over the entire record saying, okay, now you can take it and join another HMO. So that was the thing. Again, now in today's world, it's probably a copy of the thing. It's not so much about ownership in this case. So it's a pretty tricky question, actually.
And Rahul, this is Pradeep. Just wanted to add something to that. According to the National Institute for Standards and Technology, they have a definition for information owner. The data owner is called as information owner in that. According to their guidelines, I mean, the original organization may be the originator of the actual medical record, but once it comes to the position, to the possession of a different organization, the second organization is still responsible for that information as well. But there are different levels of data ownership, and definitely the second institute is also responsible for it. May not be at the same level, but also at the closest level to that. Yeah, over. Thank you.
Okay. Rahul, if you'll go to the next question, and Rahul, you're right, that's a tough question. So healthcare facilities serving disabled populations might wish to systematically review concerns by adding specific patients to instruments, consulting periodically with advocacy groups, reviewing patient complaints raised by disabled individuals, or reviewing their compliance with Americans with Disabilities Act.
Yeah, interesting. A lot of folks use D, which I know I would have probably answered that too, because hey, it's a law, so I have to be compliant. It's tempting. Answer here is A, but a lot of folks like answer D over here. So
but the key here, right, Rahul, is the systematic, right? Again, this is the I know this is repetitive. I heard it while I was on, logging in. Like, you have to look for these key words of systematic, right? The other are episodic or perfunctory, right? So systematic is the key for the answer for this one.
Yep, that's kind of why it was the right answer. Anyone wants to more clarification, or is that clear now of why A was the right answer?
I'm still kind of still thinking like the ADA one, because I feel like that's like a specific act that you'd want to be in compliance with, and it kind of links systematically because there's a systematic way to review it. So I don't really understand that one.
So Rahul, maybe this is a way to I think about it is just reviewing compliance with the ADA would not systematically review all concerns by those with disabilities.
Right. And this is Nita. I'm just saying, Jason, for me, from a researcher standpoint, right, I saw it as, when you say systematic review, the tool itself and measurements. That's how I looked at it.
And do you remember if you answered it correctly?
I did.
I did. I wasn't trying to call you out. You did. Okay, I wasn't trying to call you out, but.
No, I didn't. I just looked at my paper. I didn't. I missed that one, but I changed the answer because I didn't think that it would be that. I went with what the young man just said about the ADA part. Like, right, knowing the Disability Act, that just jumped out to say, make sure that you got certain things in place. And I thought choosing that one included all the other options when I first looked at it.
But reviewing compliance with that may not identify all the underlying issues with disabled populations.
Yep, I think those are the two words. Systematically is one. So basically consulting, the other two options, like consulting periodically and reviewing patient complaints, as Jason said, those are episodic. So those are out of the way. That leaves you A and D, as Jason was saying, now you're down to 50-50. Right. And then the other way I think about it is I want to review concerns. What is it that I want to do? So if I want to review concerns, just looking at compliance will not tell me if there are any concerns, because I'm looking at the law, I'm looking at a book or a series of rules. Am I compliant? Am I not compliant? Actually asking specific questions to patient satisfaction instruments, now that tells me what those concerns are. Now they may be right, they may be wrong, but that's the way I would review those concerns, is actually getting the data. The ADA is a good rule book to look at and verify that you are compliant, but doesn't tell you what the concerns actually are. So I think that's probably why A is correct than D. So does that now make sense?
Yeah, that does, Rahul. Thank you.
All right, Andrew. Sorry, I can't see everyone on now that I'm doing three things, so if I get it wrong.
Right, so the healthcare executive with opposing duties, meeting one of which makes it impossible to meet the other, has and this is almost like a definition question, right? So it's a conflict of interest, right? It's the definition of it in the book. I mean, it's the direct definition. So speaking of definitions, I will tell you, Raul, I think you and I talked about this many moons ago when we did this before and I did my session. There are the ACHE cards. I don't know if they're still out there. They're strict definition cards. I don't know if you've shared that with the group. I'm not trying to sell or promote a particular product. I did purchase them before I took my exam, and I reviewed all of them except the ethics and professionalism section, just because I felt like I knew that answer. But it's a way for you to say, oh, they still have them, thank you. Yeah, it's a way for you to look like what core areas can I review definition wise. It doesn't help like answer particular questions, but it does help clarify definitions. And this one was in there.
And one other thing regarding professionalism and ethics on the ACHE website, and you may have covered this in your video, Jason, but they have all the ethics, all the what you can say positions of ACHE on different issues as well. They have position papers on there, and some of those are very long. So maybe, I mean, if you have time, go through them. It's just good to read those positions as well. But at least skim the titles and read the highlights of that at least. I would encourage everyone to download all the papers, read at least the first few paragraphs of each of those papers. So they just clearly define what ACHE is expecting from an ethics point of view. So.
You'll see, I said this in the video, Raul, that there's too many. I mean, well, you could, Raul did, but there are too many of them to read. There are a lot of them to read. So I think skimming them is probably in your interest. It's very hard to read all of them and to maintain all that knowledge. All right, 22. The ethical precepts or organizational philosophy that guide an organization's activities are found in a variety of sources that are B, written and unwritten, right? It looks like the overwhelming majority of you got that. It's the broadest and most correct, right? I think is the answer. As sort of written here, A and C only partially explain it, right? So reflected in everyday actions, but that may not necessarily be true. That only partly explains it, okay? Because the actions are still the written things that the institution talks about. And the actions may not match what the written word is. And sort of ethical precepts are not just applicable to senior management or the governing body. So you could get it down to A or D, right? Because, and then narrow it further from there.
Is it clear to those who answered A and C over here?
Yep.
Let's go to 23.
So the most common and useful way to overcome resistance to change in organizations are education and communication, committee and task force, manipulation and co-optation, inspiration, leadership, and managerial skill. So look, which one could we delete right away? Right?
A.
Okay, A, I think A, yeah, because we all, right? I think the other thing that we could delete is C, right? Thank you for the scratch, right? Because this is the ethics and professionalism section, and the ethics and professionalism section is never going to say, well, you should manipulate people.
Yeah, and in general, for the entire Board of Governors exam, no manipulation, no playing politics, no co-optation, no coercion. In fact, in my last session last week, I said no control. The word control is also bad. It's about accountability. So yeah, manipulation, co-optation, that's the one that's definitely.
Okay. Does that make sense to everyone?
What's bad about inspirational leadership and managerial skill?
So why not D? Is that what you were just asking?
Yeah.
Okay, so why not D? I guess.
I wouldn't see B as like the only way, right? So regardless of your, the leadership, education, and communication are more necessary than inspirational leadership. I mean, you don't have to inspire me to educate me.
Yeah, and the way also I would add to that is just looking at the options. If you think of inspirational leadership and managerial skill, what they are asking is the most common and useful. So common, I mean, yeah, inspirational leadership exists, but is it like available everywhere? So it's not everywhere. It's managerial skill can also be a little bit varied. Like some are good managers, some are not good managers. So it's not the most useful or effective tool. And that's probably why inspirational leadership, it's not that common, or it's not available across the board. That's probably why it's not true. And the committees and task forces, that's the way things are done. It's very common, but the utility is questionable. So committees and task forces often end up accomplishing nothing. So that's why it's not probably the right answer. So
yeah, it's sort of like A doesn't meet the disjunctive and the useful, and D doesn't meet the first part of the disjunct comment.
One more thing, I think option B, describing the inspirational leadership and management skill is basically the attributes, but the main activity is education and communication, I think. This is how we can justify this answer.
Sure. Yep, I think that's a great way to think about it. All right.
Any other thoughts? Let's move to 24.
Coordination among governance, management, and professional staff is a major problem for most of healthcare. A common way to solve the problem of coordination is to, a lot of you put B, but there was a number who did not. So overlapping committee membership, right? This is sort of comes from Dar's book. It's a common technique used to enhance the quality of decision-making because you have people on different sort of committees. So those of you who marked A, coordination, provide a local area network of leaders of each group using personal computers. So common, I think, again, common way to solve the problem of coordination. Are you going to coordinate if there's just local networks? There's not overlap between them. I think if I have understanding of that response. Bringing issues of concerns to groups are only going to bring it to their particular group. Again, it's not going to be coordination amongst different groups. And so you're negating, C is negating the question in a sense. And then policy statements do not, I mean, they ultimately just don't solve the answer. They just don't resolve it. And none of you put D, so semi-clear on why B is the right answer. Okay, next question. In an effort to encourage licensed clinical staff to engage in continuing education, healthcare executives are given substantial assistance by the fact that these professionals are, and it looks like the overwhelming majority of you put, must meet requirements for their certifying group. So A and C stimulate interest, but they don't. They're secondary. Choice D doesn't really make any sense. So it has to be B. Questions about that one? Okay. All the following are elements of a profession. A, B, C, or D. And this one, okay.
It's like there's a lot of spread in this one.
Say it again, Raul?
There is a lot of different answers that people pick for this.
Yeah. Okay, so this one I would go, one, I can tell you C is in the books. So in all of the books about a profession requires a code of ethics. In fact, ACHE says this in a lot of their manuals. So all the following are elements of profession except. So we know a code of ethics is a part of a profession. I think it's in the ACHE preamble, or I just recently read this, that a profession requires the normative transmission of norms and values. That's what it requires. Physicians, it's the same way. Nurses, it's the same way. And every profession requires service orientation. This is really sort of a definitional question, that the three A, B, and C are what make up a profession. There is no number of years required to be a profession. So you can be a healthcare executive irrespective of the number of years you serve in a profession. And it might be interesting to know that maybe is why they limited they reduced the number of years to get FACHE.
That's a good way to think about that.
Potential professional. So, all right, questions on that one? Yeah.
Nicholas, you have a question?
No, I was just celebrating that they reduced it to 1 year.
Yeah, I was there for All right, if a governing board member is a decision maker for a company that conducts business with a healthcare organization, there exists a, okay. All right, so there was a lot of variability in this one. And Rahul, I will tell you in this question, this one's tough for me. I struggle with this one too. It's not D, right? I think the way I do test, of course, is I work process of elimination. I don't think it's an asymmetrical level of power. It's not, right? Is there a conflict of interest due to violation of a duty to or due to violation of justice, right? It's not a conflict of interest due to justice, right? So now we're left with B and C. So how would we decipher between B and C? What does the group think?
I missed this one. What was the correct answer on this one? Because I had a really, really hard time, and time was running out. So I had a real hard time with this one.
Mm-hmm.
I can't say, oh, B is the right answer. Okay.
Jason, do you have a strong reason why B is the right answer or C?
So, do I have a strong reason? Is that what you asked, Raul?
Yeah.
I actually don't. When I originally took this, I thought there existed a conflict of interest.
Mm-hmm. Yeah.
Right? The problem is the added language that's added onto the conflict of interest. That's the only thing I can think, because the correct answer is B.
Yeah, and so the reason I put in this question is there are two questions. So there is, as I mentioned in the introduction, we have over the years collected a lot of questions, and there are two questions on which this is one of those two, and you'll see another one in finance where there is always, okay, that's not the right answer. That doesn't make sense. Right. So yeah, this is one of those where actually, I mean, while the answer key says it's B, C is probably correct. It's not resolved.
That's what I said.
Yeah, the reason I put this question into today's test is you may find one of these on the exam where you just think, okay, that must be the right answer. And don't worry about it. Don't stress about it. Just if you get it wrong, probably everyone gets it wrong. Like, yeah, 75% of the people got it wrong if the answer key is wrong. So I know I'm one of those who has taken so many exams that I want to fight about every question if I want to, but during the exam, there is no one to fight with. So just pick an answer. Sometimes you just get it wrong and it's okay. So that's why this was put in there more than anything. So both of them, actually, the reason why both of these could be correct is that, yes, there is an opportunity to receive discounted prices. And yes, there is a violation of duty of fidelity, which Larry will cover more in governance about all these duties, conflicts of interest types, so on and so forth. So there's both of those are kind of correct. And so, yeah, sorry, I do not have a very good reason why B is right. That's the way the answer key was designed.
The professional ethicist in me says that C is the right answer. So the BOG is wrong about that one. Okay.
That's how we'll go with it.
All right. The large gifts to tax-exempt healthcare organizations do not suggest a conflict of interest. So remember, keyed off, just reading the question, do not suggest a conflict of interest, right? So whenever you see not, keys off to me. Large gifts to tax-exempt do not suggest a conflict of interest, whereas a large gift to a manager of such organization is likely to be ethically unacceptable. The difference is that what? And the correct answer is D, and almost half of you got D. So let's talk about managers failing their duty of loyalty to the organization by accepting gifts. That's not true. You wouldn't fail in your duty of loyalty if you accept gifts. It's not a duty to loyalty that you fail in, right? Organizations are ethically neutral entities in the eyes of the public and the law. That's not true. They're not ethically neutral entities, right? They all have stakes and interests. So gifts to the organization benefit both the patients and the general public. That may not actually be true. So you get left with no direct individual relationship is established by giving to the organization. Okay, questions about that? So it's either a process of elimination, or you could go to D and say, right, that there's no direct relationship. If you give it to an organization, you're not giving to a person. I mean, the court ruling did say that organizations are for people, the recent court rulings in the last 10 years, but we're not going to argue whether that's true or not, whether organizations are people. All right, next, two more questions, I believe. When a healthcare organization's goals conflict with its stated positions of a professional society, the professional individual's responsibility is to make known the stance of the profession and reconcile the divergent positions. 81% of you picked that. That is the correct answer. Enlist the support of professional colleagues to alter the organization's position. It's not, it could be that the reverse, that you need to change the organization's or the professional position, support the professional society's position, or support the organization's position. So the individual's responsibility is to make known the stance of the profession and reconcile the divergent positions. So if the organization, I'll give you an example. Say you work for a healthcare organization and they're saying you should euthanize patients over 25. Okay, anyone who comes into the hospital should be euthanized if they're older than 25. I can tell you that every professional organization that you probably belong to is against euthanasia. Even though those that are for physician-assisted suicide, they're against euthanasia, okay? So what is your obligation as an individual is to let your organization know and tell them that the positions need to be reconciled, right? B assumes that you can actually change it, right? And C or D says you support one or the other. Your professional obligation is to reconcile the divergent positions. Nita, you put your hand up.
I did, and I guess I just need maybe a little bit more here, because I'll tell you, I'm one of those that answered D. And the reason I answered a D is because my thought is when it said professional individual responsibility, the way I thought about it, either you accept it or you leave. That's just, and I know the question, the answer didn't say that, but when I look at the other options, I try to figure out as an individual, how do I do the reconcile and divergent the position? How do I as an individual do that? So I got stuck and wasn't quite getting how as an individual I could do that. So I'm not getting that.
Okay, so Rahul, you can weigh in here too, feel free. But what I would say about D, why D might be problematic is, as a professional, you're not supposed to, you're not supposed to support an organizational position that is against your profession, right? So that's ideal, and that's what we're talking about. So that's why D, I think, doesn't work. Go ahead, Raul. Do you have other?
Yeah, another thing I'll just, again, this goes back to what ACHE is like thinking, right? So they are expecting all of us to be healthcare leaders, like professional healthcare leaders. So as a leader, when you are faced with a difficult situation, do you support the professional society's position? Do you support organization's position? Anyway, anytime there are two conflicting groups, what they expect us to do is have all the viewpoints to be brought to the table, discussed, analyzed, and then make the best decision. So that's why A is correct than the others. Ultimately, yeah, after all the analysis, it may be that the professional society was right or the organization was right, but it's just going up front. You can't blanketly say, oh, I'm going to support my professional society, or I'm going to support the hospital, or whatever else I'm doing. And then B is this thing which I said on an earlier question. B is basically playing politics. So that's obviously the wrong concept. So B for this one is totally wrong. Then this one makes you assume one position or another. And whenever you're in those tricky positions, the main thing to do is have all the views to be studied and then make the best decision you can. And it's not just this. It can be, the question can be anything. It's typically the answer. And like nowadays, what's happening? There are difficult ethical questions even now, like the thing that's going on with transplants and unvaccinated patients. So are organizations correct in denying transplants to unvaccinated people? It's going to be a big, huge discussion. There will be those who will say yes, those will say no. So not for us to, the main key is not to take a position without studying the entire thing, which is why A is probably the best answer. Does that make sense?
And then Nina, it's almost like it should have said the professional individuals' first responsibility is to, or primary responsibility is to do this.
Yeah, and I think I probably would have, but see, I'm even though I've been in leadership for a while, I'm just not, I need to switch to thinking as a leader whenever I'm thinking of these questions, because I kept thinking the individual aspect of this question and how I could do it. So yeah, okay, but I mean, I got it. I understand.
As Rahul has told me before, don't think about it as a leader in your organization. That's not the way to think about it. It's like the Plato form of leader, and think about it. I mean, I'm any Platonic scholars on here, but that's sort of the idea, right? You're thinking about it from ACHE's leadership.
Yeah, and always, as I've said it before, and I'll give this on a slide as a mantra, you have to remember this whenever you're confused. You are the CEO of a not-for-profit, community-owned, standalone hospital. That's what you are. And then answer the question that way. So regardless of your current position, that's what ACHE is designed these questions for.
Yep. All right, and then the last question that we have is, which of the following conditions, Nita, this should be good for you. Which of the following conditions, we hope you answered it correctly, given your in human subjects research, should be met before it can be used in medical research program? Which of the following conditions must be met?
D.
D. Correct, D. Okay, questions about why it's D. So I see a number of you picked other ones. So the research program has been approved by the medical staff. It doesn't necessitate, right, for human subjects to be used in a medical research program that the medical staff has to approve it. Okay, so it's not B. That no suitable animal model exists for the use instead of people. Well, there's tons of research that goes on that don't have animal models, right? And there's tons of research that does have animal models. So that isn't a must, right? So now you're down to C and D. Okay. Technically, C is right. So the research, The research program has been approved by the governing authority. And I think, Rahul, if I remember, that's by the Board of Governors. That's what governing authority is. It's not the federal government. So don't interpret it as the federal government.
Yeah, it's the governing
authority. Have a
authority.
research entity and an organization that's not approved by the, I mean, it doesn't have to go to the board for approval. And therefore, D is the one that's left. And D makes sense, right? In research, we have to clearly explain to participants.
And this was the question I was mentioning earlier, which is one of those rare questions where governing authority is one of the options and it's the wrong one. So just, it's typically 99% of the cases, if you see governing authority and the word ultimately or something, it's probably that one, but this is one of those rare ones. And again, this is to do with probably the way I thought about it was, if a human subject is to be included in medical research, it's make sure that that person knows the risks and benefits, right? So if that's, even if it is approved by whoever and other people think it's a great idea, if that individual doesn't understand the risks and benefits, then including that person is just not ethical. So it's this classic case where I forget, was it, oh my God, I just have a block about this, but the cells of a lady for cervical cancer was used, and it's an ongoing news.
HeLa, Henrietta Lacks.
Yeah, the HeLa, and it was those cells were taken without her consent because the concept of consent was probably very ill-defined in 1950s. But now, fast forward all these years, now there are lawsuits about were they authorized to use those HeLa cells going forward. So that's kind of the thing. So you have to explain the risks and benefits. Yeah, the doctors at that time thought it was a great idea. The researcher thought it was a great idea. Maybe whoever was the organization, they thought it was a great idea and approved it. The pharmacy industry definitely thought it was a great idea, but the lady, she never gave consent, probably because that didn't exist. But that's one of those, right? Probably D is the best answer. Any questions or on ethics itself? All right, I know we are over, but it was a lot of questions and important material for us to cover. So I thought it was just fine, we'll keep going. So you have any other questions for Jason on ethics or any of the material itself or any of these questions?
Well, just so everybody knows, I know we're not supposed to report out on particular questions, Rahul. You're not supposed to relay questions to people, but I do remember from my Board of Governors exam, definitely the questions that came up. There were definition questions around, I remember something about advanced directives was in there. I remember something about an ethics committee, the core functions of an ethics committee was there. There was definitely some stuff about statements, policy statements. And I think I remember the governing authority was actually in my questions. So.
That's a good good few topics to have there. So knowing those definitions.
I want to ask one question before we get off, because I'm approved for the exam, but I haven't written, did the second part yet. So with the exam, is it like, I just know with my board of nursing and my NP, I went to a place and took the exam. So is it the same thing with this? You find a location and like do that? Okay.
Yeah,
okay.
So it's those Prometric or one of those centers. And, and those are just, you go there and you take a convenient appointment and just do that. And we'll go a little bit. I do want to have a little bit, a small session sometime later during this webinar series where I'll kind of describe what you experience over there, because it was a little unnerving for me. I'll tell you my personal story. I think Jason has heard it. It's like,
I've heard it.
Yeah, I had a flat tire. I had to take it in Augusta and I had a flat tire and I was late and all that kind of stuff. So things happen. Again, not to get too stressed, 6 hours is a long time. But the most unnerving thing, and I'll encourage you to do this, stay away from every possession you have, especially your phone. because when you get into that room, you have nothing on you. So you don't have a pen, you don't have a pencil, you don't have anything. You just go in like, well, the clothes on your back, no keychains, no nothings, no physical possessions. So that's very unnerving for us in this day and age to stay away from that for 6 hours. So, you know, I'll go over that more in detail in one of the sessions, but yeah, you have to go to one of the centers and take that exam. So.
Thank you. Thank you.
And yes, Lauren, we will send the PDF.
I have a quick question. Again, thank you so much for a great session. I just have a quick question. When it comes to the exam, I know it's like 280 questions. Are these questions grouped together based on the section, or they're all over the place?
No, they're all over the place, which is one of the things over here, you know, like the first 15 are all healthcare, next 15 are ethics. In the real exam, you won't know. And partly don't focus on that because as you saw from today's questions, or yeah, last week's, some of those questions can belong in different sections. So today we talked about conflict of interest, and next week when we do governance, Larry is going to go over all of that again. So because conflict of interest is a big topic and it's from different points of view. So yeah, don't worry about which section anything belongs. The distribution which is on ACHE's website is just a suggestion. So if they are expecting like 10% of that from ethics, then you won't see 50% of the questions on ethics. So that's all. That's what you have to do.
Okay. Good. Thank you so much. And are they still throwing the theory extra questions just to get the sense of future exams? They still have that? Okay.
Yeah, they will. And some of them will be very apparent. Like if they start asking questions about ethical dilemmas around COVID-19 immunizations or something, that's a test question because they won't get there until 2 more years. So, but some of them actually you won't know which ones are test questions. So when you answer a question, just think this is all great. So just go ahead and do that.
Okay, sounds good. Thank you.
All right. Any other thoughts or questions for Jason? And we will be sending out the videos from next week onwards a lot earlier. We just had a delay this week, so you will see that earlier, probably over the weekend for next week's videos, and hopefully for the next few weeks we'll be able to do that. So you'll have plenty of time to look through all the videos. Okay.
Thank you all very much. Very nice to meet you all.
Yep. Thank you, Jason, for your time. Yep.
Thank you, guys.